Thank you, everybody, for joining us today. I'm delighted to introduce this next session in our series, which is part of the COVID-19 response group that we've developed in the Moore Institute. Our topic today is Ireland, borders, and COVID-19. As I say, we've had a series in the Moore Institute. In fact, 5 have taken place already. We've covered a range of different topics about data ethics and so forth, education, about slavery, race, and COVID-19, and other topics. And those are available on the Moore Institute website. The links are there in our YouTube channel. Today, we're discussing a topic that engages everyone on this island. It's the role played by borders, the challenges associated with them, and the opportunities for collaboration across them in dealing with a disease that obviously does not respect borders. And in that sense, I think our discussion today has a wider significance and indeed a potential for comparative dimension beyond Ireland. We're very fortunate to have an excellent panel of contributors today. We're joined by Dr. Katie Hayward, and Professor Neil Dougherty, and Dr. Gabriel Scally. I will introduce them in the order that they are going to be speaking in. So I'll start with Katie. She's a reader in sociology at Queen's University of Belfast and a senior fellow in the UK in a Changing Europe, which is a think tank where she is leading on a major project on the future and status of Northern Ireland after Brexit. She's a leading expert on Brexit. She's contributed widely in public forums to this, particularly in relation to the Irish border. She's had the opportunity to present before several parliamentary committees and policy groups in the UK and Ireland, the EU, and the USA. And she's the author of many publications. Her most recent is a co-authored report on the subject of the post-Brexit governance of Northern Ireland. She's an Eisenhower Fellow, and in 2019, she was awarded the title of Political Communicator of the Year from the Political Studies Association. Gabriel Scally will speak next. He was born in Belfast, and he's studied medicine at Queen's University. He trained first in general practice and then in public health. He was director of public health for the east of the province until he moved to England to be a regional director of public health. He recently assisted with the inquiry into the hyponatremia-related deaths in Northern Ireland and carried out the inquiry into the cervical check failures in the Republic of Ireland. He is currently a visiting professor of public health at the University of Bristol and president of the epidemiology and public health section of the Royal Society of Medicine, I should say. He is a member of Independent SAGE, and that's a group that was set up to contribute to open and independent scientific advice on the coronavirus crisis in the UK. And our third speaker is my colleague, Neil Dougherty, and I want to thank him for developing the concept and bringing this to the Moore Institute. He's personal professor of political science and sociology at NUI Galway. He's published extensively on Northern Ireland, on conflict and mediation, on peace negotiations and territorial conflict. There's a monograph coming out with OUP on deniable contact, back-channel negotiation in the Northern Ireland conflict. And he has a variety of other publications, including a co-edited book on political violence in context and dynamics of political change in Ireland, making and breaking a divided island. He was a founding convener of the Standing Group on Political Violence of the European Consortium of Political Research and the Specialist Group on Peace and Conflict of the Political Studies Association of Ireland. Delighted to be joined by so many people today. Thank you for attending. Attending via Zoom, there are a couple of different options to participate. There's a Q&A function, and we welcome your questions there. There's also the chat function, as you will see. So do record your comments there, and I'll do my best to keep track of the points that are raised and to try to feed them into the discussion. And it gives me a chance also to thank David Kelly, our digital humanities manager in the Moore Institute, who's working behind the scenes to keep everything running. So that takes us to our topic today. So I wonder if I could begin with Katie and to ask you to speak and give us your thoughts on this challenging question of Ireland borders and COVID-19.
Thanks very much, Dan, and thank you very much to Neil and yourself for the invitation. It's a real pleasure to be with you virtually. So I just thought, I've been obviously writing quite a lot on the Irish border, and I just thought it might be worthwhile thinking at the highest possible level. So I've been looking at what those who are professionally engaged in border management have been saying about the coronavirus pandemic. and the implications that it has for border management, just because I know in our discussion we'll get into a lot of detail about the island of Ireland. So it's notable that this whole pandemic is being treated amongst the border management community, if you can put it that way, in terms of an event as significant, of course, as 9/11 was. So 9/11 changed the way that borders are conceived of and managed across various types of organizations and states, of course. And this is a very similar case in that we've had the need for close cooperation. We will have the closer cooperation needed between states in managing borders after this. And there's very much a sense of never waste a good crisis, if you want to put it as bluntly as that. And I thought it's just worth having a sort of headline overview of the way that borders have been conceived in this framework. Bearing in mind, of course, as we saw in the blurb for this event, the borders are always points of connection, not just barriers or points of obstruction. And of course, borders, as I've often repeated throughout the Brexit process, borders are used for different things. There are different types and different harnesses of borders, if you like, depending on what movement you're talking about. And it's worth thinking about that in relation to the coronavirus pandemic, because for the movement of people, of course, we've seen more or less a stop of movement of people across air and sea borders to a large degree. And some constraints on land borders too. So there was a fall in air passenger travel by 85% in the month of April. And we've all known just quite how significant that shutdown in air travel has been. So for the movement of people, right the way down to obviously our domestic constraints, it's been very much shut down as a result of the pandemic. Movement of goods, we've had a different type of approach. PPE and the quest for PPE between states has been something that's obviously been greatly sought after, and the movement across borders for that type of equipment has been, of course, seen as urgent, and a real pressure on states in relation to that. At the same time, borders have been having to be managed in relation to a rise of illegal movement of goods, particularly counterfeit medicines, and fraudulent activity in relation to organized criminal gangs trying to exploit this new crisis. So, for example, the selling of such thing as corona spray or made-up medicines or home testing kits. All of this has meant that borders are points of vulnerability, and there has to be cooperation between border management groups, border management agencies to try and deal with all of this. And another interesting point in relation to movement of goods across borders in this current crisis has been an increase in e-commerce. So speaking to any border agency around the world, there's been a real focus on e-commerce as a sort of existential security threat, and a real concern about, you know, the risk of illegal goods being moved through small packages. But of course, in the coronavirus pandemic, we've seen an increase in this because even though we're confined to our homes, we continue to purchase goods. And so there's been a huge rise in that type of activity of movement across borders. So globalization continues to be a thing, and we continue to be dependent upon it, even from within our own homes. So where is all this going in terms of border management at the sort of global level? Those who want to kind of see a move to more smart borders, what have they got their eye upon coming out of this pandemic? Well, of course, border management isn't just about what happens at the border as you arrive at a border, but also what happens before, of course. And again, the 9/11 lessons are quite interesting in relation to this. And there's been a sense of seeing the virus in a sort of rather crude way as a sort of unseen threat that is carried among us in a similar way to the way that terrorism was seen as a threat carried by people, and particularly movement of people across borders. So the question is, how do we manage that? Well, it's about what happens before people get to the border and then what happens at the border as well. And what it basically comes down to is information. And this is how we will see the connection between our daily lives and our experience of sort of social interaction going forward, as that's been very much affected by borders writ large, if you like. So in managing borders in the future, particularly in relation to the movement of people, we will see more communication and coordination, not just between border agencies, but between health officials, if you like, and border agencies. And it may be the case that in moving across borders or certain types of borders in the future, there may be increased demand, not just in the use of biometric information, but also the need to carry a health certificate, for example. And then when we get to the border, you'll have the experience of the sort of the physical border too. And of course, I should stress I'm not talking about the Irish border in this case, but an increase in airports in particular, in maybe having testing facilities, but also facilities for quarantining as well. And again, the parallels with the response to terrorism are kind of interesting here. A fundamental to it all is this sense of the individual wanting to get across the border in as efficient a way as possible, but also being kept safe. And at the highest levels, the need for good border management or detailed, effective border management to have as much information as possible. So ultimately, it comes down to that question of how much information are we willing to give, even in terms of the app that we carry around on our phone, in order to be able to have borders experienced for ourselves as individuals in as open a way as possible. And that's my opening remarks.
Thank you very much, Katie. You know, there's all sorts of things that struck by that, and I'm sure we'll come back to them. I was thinking for some reason about Boris Johnson's peculiar imagery when he returned to in front of number 10 of the mugger coming up behind him, unseen and unannounced. Not sure that has to do with borders, but it was also the stealthy operations that we don't know they're happening to us, and yet they're happening to us. Yeah. On that slightly curious note, I apologize, Gabriel, for introducing you and transitioning to you with that thought. But yeah, welcome your thoughts and contribution.
Thanks very much. A very disturbing thought to send me off with, I must say, about Boris Johnson being mugged. I suppose my biggest connection with the border, the human-made border in Ireland, the politically made border in Ireland, came when I was a GP trainee in South Armagh in Mullaban. And I used to be back and forwards across the border all the time. Down one road, you'd cross it back and forwards several times. And I lived in Newry for several years, so I was well used to some aspects of the border. When I think about, but I suppose I'd stopped thinking about that. And when the crisis started, I thought about a different border, a natural border, and the advantage that islands have, the island advantage, as I've termed it, in terms of dealing with an infectious disease, particularly something that spreads as rapidly and as easily as this does. The islands have an enormous advantage, and that has played out right across the world. The examples of Japan and New Zealand, Australia, and even a virtual island, South Korea, have all played to that advantage phenomenally well and saved tens of thousands of lives, undoubtedly, in their population by taking real advantage of the natural border of the sea. And I kind of automatically assumed that Ireland would do that. I knew, for example, from the foot and mouth outbreak some time ago now, but that biosecurity was a matter handled on an all-Ireland basis. And the arrangements I knew were strong, and they were mutually respected, North and South, as being to the advantage of both. And I kind of assumed that things would operate that way in terms of infection control because of the movement of people back and forwards across between Northern Ireland and the Republic. It seemed to me the obvious thing to do. So I was very surprised when, well, several sets of surprises, I think. One was there seemed to me to be what later came to be described as British exceptionalism, and I think that's probably a very accurate description. The notion that somehow the UK didn't have to take the same steps as everyone else had to do to deal with this terrible episode. And even when they took steps late in the day. And I was further very surprised to find that this wisdom which emanated from Whitehall was being followed almost without question in Scotland, Wales, and Northern Ireland, despite the devolution of powers to, particularly for health, to Wales, Scotland, and Northern Ireland. They followed along with the political direction and the decision-making set by Whitehall, even though we weren't allowed to know what the science was that they referred to at every turn that was supposed to be driving their decision-making, but we could never see that science. So the issue of the border really came into focus in my mind when on 12th March, the decision was made in the UK to stop searching for cases, testing, contact tracing, and isolating people. And that policy continued in the Republic and was further reinforced by the nonsense of having, for the UK, a period of time of 7 days when people were asked to isolate themselves when they developed symptoms. Whereas it would be 7 days in Strabane, but if you crossed over the bridge to Lifford in Donegal, it would be 14 days. And the 14 days was entirely in keeping with the World Health Organization recommendations and other international organization recommendations. So this to me seemed to be absolutely stupid to take such differing approaches on the one island. And particularly given the limited resources we had in some respect across the island, it seemed to me that utilization of those resources would be very, very worthwhile. And I think it speaks volumes that there had to be a special memorandum of understanding drawn up between North and South and agreed by the ministers and signed by the chief medical officers of both parts of the island in order to facilitate cooperation that one would have thought would have come easy. So clearly there are borders there. When I challenged this, I was also, I think, more disappointed than surprised to find that there was still a very strong political division in the North about, firstly, the terminology that one was allowed to use in the North, and secondly, the consequences of describing the situation. The terminology, I tried very hard to always talk about an all-island solution, but I almost immediately, on using that, was termed a Republican, and I was trying to take advantage of this terrible crisis in order to score political points or to achieve a united Ireland by the back door, as if I had control over the virus in some way, I thought sometimes. But it did have a very sharp and a very sectarian edge to it. And some of the work that's been done by a very fine academic in Belfast, which showed that the performance, and if you can talk about performance, it's a terrible way to talk about it, but the level of deaths per million population was higher in the North than it was in the South, which seems to me to be a reasonable observation to make if it is true, and I have every reason to believe it is true. But it did go down very badly with quite a lot of people who seemed to regard it as an attack upon the sovereignty of Northern Ireland, which of course it wasn't at all. But it seems to me that that border mentality has almost been reinforced by this outbreak at a time that it should have been reduced. There were good sides to it as well, in the spread of good practice. For example, in the North, parents and headmasters took the initiative and closed schools themselves. They decided not to send their children to school or to close the schools if they were heads or groups of heads ahead of the official decision in Northern Ireland, because they'd seen it happening in the South and couldn't understand why it wasn't happening in a delayed sense in the North. I think there are undoubtedly, and Katie mentioned the decline in air travel, and one of the fascinating elements of it is that the Pew Center in the US has looked at border controls on public health grounds that have been put in place as a result of efforts by states to deal with this virus. And more than 90% of the world's population, the last time they looked, which was a few weeks ago, lived in countries where there were border controls in place specifically to deal with the public health aspects of this, to restrict movement or restrict flights or whatever. But that, of course, hasn't applied to the common travel area of Britain and Ireland. And although there has been tremendous restriction in flights, those restrictions have not been, as far as I can understand, applied in any way by either Britain or Ireland. In fact, our health in Britain and Ireland is being protected for the moment, on the most part, from an influx of new cases by the decisions that other countries have made about our border, i.e. that people will not be able to get to our border in order to come into the country. And I think that really creates a very interesting situation between the UK and Ireland about how to take that matter forward and the issue of quarantine. I think what it does, however, lead us towards is an understanding that, well, we can't allow this to continue in the future, and we need to find a way of harmonization of approaches north and south. And I think there are opportunities arising out of this crisis to progress that, particularly in the light of Sláintecare in the south and the progress that hopefully will be made along the way. Both governments in their own way have responded to this crisis by making major decisions and major changes. And my hope would be that when it draws to an end, as it will, in whatever fashion it does draw to an end, that we don't miss the opportunity of taking advantage of the learning from this episode and doing something to make sure borders can't interfere with our public health. Thank you.
Thank you very much, Gabriel. Yeah, one of the discoveries I think for ordinary members of the public, myself included, has been of how the different responsibilities for health are managed, and the divergences in Scotland, Wales, Northern Ireland, England has been very striking. But we see it elsewhere. In the Netherlands is another interesting case. We might come back to that. Neil, over to you. So looking forward to your thoughts and comments.
Hi, thanks, Dan, and thanks very much to Gabriel and Katie. And I'm going to try and make some connections with some of the points they made. I'm going to offer some more general thoughts on borders and boundaries in general and their importance during the pandemic. And I'm going to show a few images to illustrate these points. Katie mentioned borders there, talked about borders, and Gabriel as well, and primarily in terms of national borders. And that's where we go when we talk about borders. We think immediately of national borders. My own research looking at conflict in the North in the 1970s and 80s, in that research I was really interested in the connection between different kinds of borders, so local neighborhood borders, regional borders, electoral borders, and how those borders at lower levels gain a lot of their charge and their meaning and their importance through their connection to an international border. So that gives them an extra kind of meaning. So there are these interesting links between borders at different levels. And although the pandemic has brought national borders to the forefront, it's also led to a proliferation of all kinds of other borders of a kind that we never imagined having. And the repurposing of existing borders and new meaning being added to borders that never had a very strong meaning before. I think, for example, at a very early stage of the way in which Italy, at a very early stage of the pandemic, restricted movement between regions in Italy. And so the regional borders become suddenly something that, people didn't envisage them becoming a barrier to movement, a zone that you might seal off. And of course, we've seen the images from China of checks going into cities. So cities become bounded. You get these new borders around particular areas. So you get a proliferation of borders, you get new physical boundaries. And I'm just going to show a couple of images from Galway, all within my 5-kilometer zone, I hasten to add. And this is just an example. This is at Blackrock Tower on the promenade in Salt Hill, an example of a new kind of barrier, physical barriers sealing off certain spaces. And in addition to those new barriers, you get a kind of repurposing of existing barriers. So this is student accommodation in the university. So you had gates, but they were generally open, and now they're closed, access residents only. So everywhere you see these new physical barriers being put up, and existing barriers being repurposed. Now, of course, in all this, national borders are being used to control movement much more intensively than they were before. But I think all of it together, the use of these borders at all sorts of different levels in a connected way. So all of these measures are interlinked, the control of space. I mean, it highlights how central boundaries and borders of all kinds are to the exertion of power, because they're so effective in controlling interaction, shaping behavior, and controlling movement. And I want to talk about one of the most interesting boundaries, which is a boundary that's everywhere, that's more or less all over the globe now in slightly different forms, and that all of us are now intimately familiar with. And that's the 2-metre radius, 1.5 in some cases, 1 in some cases, that now surrounds every single one of us. I think it really nicely illustrates the connection between a kind of a boundary in the mind. So we carry this around with us in our heads. We have to remember it. We have to be mindful of it. We have to judge it. We don't always judge it accurately. We have to protect it against others and respect that boundary around other people. So it's it's very much inside our heads, but it also has this physical manifestation. It's a mobile boundary. And I just want to show a couple of images that kind of represent the physicality of that boundary. This is a sculpture. I used to show an image of this to students in my class on conflict and territory for many years by a sculptor called Jenny Heichman, Space, Divided Space. And I knew it said something about territory, about and boundaries, borders. When you draw lines between, when you cut a space up, you create entities that take on a kind of distinct, you isolate different patches of ground, and they take on a character of their own. And I thought of this when I saw these images the other day, which are efforts at this in San Francisco to actually map that 2-metre space out on the ground, to draw circles that are 2 meters apart. And this is a sort of a more populated version of it. And I think it's just a beautiful illustration of that, sort of the fact that this is a border that's in our minds, that we have to carry it around with us, but also something that is a very real physical boundary, even if it's mobile. Okay, so I just want to make one final point, and that's about national borders and other borders. So I think, ironically, in this age of very loud nationalism, it brings home the importance of other kinds of boundaries that are not national boundaries. I think it makes the point that national boundaries are not the only important boundaries. If they were to disappear tomorrow, power would be exerted through all kinds of other boundaries. There's no world beyond boundaries, and the pandemic, I think, just brings home to us how central they are to, in this case, being used to control disease, but just to control and shape behavior in general. And they're interconnected. I think one of the most interesting potential sources of tension in the coming months is the use of sub-state boundaries. So national boundaries have this very strong legitimacy. They're associated with, they're well established. Boundaries within states, not as well established, not as accepted as a basis for restricting movement. And if we do have, and this seems a very sensible way to go, if we do have localized control of a second wave and of local outbreaks, and you designate certain areas as red zones and you control them in different ways to others, you kind of challenge that essential kind of the promise of the nation in a way, is that even if it's not realized, is that all of the nation is a kind of an evened out space. So when you localize control, you erode this sense of us all being in it together. And it's not, I'm not opposing this. It seems a very wise and sensible way to proceed, but I think it generates interesting tensions between national borders and borders at a subnational level. Just one final remark to connect to what Gabriel was talking about, and this is the coordination between the North and the Republic, an all-island approach. One of the interesting things there is that the Irish government has been rather slow to attempt to coordinate with Stormont. And it seems to me perfectly understandable because on one basis alone, things move so quickly, the political pressures are so intense, the potential damage to a government that gets it right or seen to move too late, I think means that in this context, governments are particularly averse to constraining themselves in any way. And the idea that you might make an arrangement with the North, or you might have to take a day or 2 more days in order to make sure that you're coordinated North and South. I think things are moving so quickly that that's one of the obstacles to greater cooperation between the two parts of Ireland.
Thank you very much, Neil, and sort of invite Katie and Gabriel back into our joint discussion for further thoughts and reflections. There are so many fascinating issues that you've all raised, and they interplay in lots of different ways. I guess the first thing I wanted to ask about was maybe a slightly different angle, which is questions of trust. And obviously the capacity to influence political behavior and social compliance is predicated on trust. Borders in interesting ways raise those issues about trust levels in different places when there's a kind of broader shared space. So I just wondered if you had thoughts about how trust is managed or perhaps maybe mismanaged in relation to this conflict. That's really, I don't know if anybody wants to put their hand up and give some thoughts on that question.
I mean, I'll have a wee go. I mean, so one thing immediately making me think of the sort of the track and trace kind of app and all the discussions around that, which I think are really fascinating, and people's responses to it, because of course it isn't just about science per se, or indeed a sense of safety. Other things come into play very quickly, and that is people's sense of, the idea of civic duty. So that's used very strongly in people advocating the use of these apps. However, that's of course balanced against this sense of trust and a lack of knowledge about where that information is going and how it's going to be used. And just to point to the significance of this thing is that, if we do, movement in the future, and partly in relation to these kind of apps, it's possible that that of course our movements and our sense of risk in where we choose to go in relation to the threat of the virus, what have you, is based on our own memory and priorities, etc. Whereas in relation to the sense of risk that people see that we are to other people, that's based on tracing our movements through this app or the information that's gathered by the use of this app. So it goes to the very heart of, it's completely sort of exposing a lot of these hugely significant changes in society, I think, that as sociologists we've struggled to really contemplate, and it's all come together in this one moment. And your point to trust is a very interesting one, because actually it does raise its biggest questions about, how we see the responsibility of state and state agencies and organizations in managing a huge transformation in our private personal data.
Gabriel, do you have a take?
Yeah, what an interesting question. And so my immediate reaction is to give you examples of where I've seen trust in operation. and what builds trust and what destroys trust. And the first thing I have to say is that transparency is extraordinarily important. I hadn't quite realized, I think, how important it is at this time. People don't expect those speaking in official capacity to know everything, particularly about a virus which is largely unknown, but they do expect them to be pretty transparent about what they do know and what they don't know. And I think the failure in Whitehall to let people know what the science is that the decisions are being based upon is a major, major failing and a major erosion of trust. And I think the second issue is about honesty. And similarly, dealing with a crisis, particularly an unprecedented one like this, it's not reasonable to expect our political leaders and those making decisions to get it right all the time. And I don't believe the public really does expect them to get it right all the time. But funnily, harking back to my experience of dealing with cervical screening in the South, what people do want to know when things go wrong is they want to know what went wrong. And they like someone to say, sorry, we got that wrong. And they like them to say how they're putting it right again. And I think I saw a good example of that in the South when the criteria for testing were very relaxed, and I think you needed one symptom to come forward for testing, and it resulted in a lot of people coming forward for testing, considerable time delays in getting the results. And they said they got that wrong. They increased it to 2 symptoms before coming forward to testing, dealt with the backlog, and the system continued. And I thought that was a good example of how to deal with a problem about being honest. Whereas in the North, it's been really difficult, and there has neither been transparency nor, I think, honesty. The difference in transparency of data and speaking to the public between Belfast and Dublin has been incredible. And it extends to the news media outlets that people are prepared to talk to quite openly. And in the North, there are some problems, I think, around who politicians will talk to. And secondly, the inability to say things haven't gone completely right and we might have done it differently. And also a lack of honesty with the data. And it was very noticeable that the Department of Health in Northern Ireland got seriously wrapped over the knuckles by the UK Statistics Authority for the appalling state of the data they were presenting to the public. So I think transparency and honesty as crucial to trust. That's one of the lessons I think I've seen played out.
No, that's fascinating, and I suppose it's also a question of trust between governments too in this context. Neil, yeah, you want to come in there?
Yeah, no, thanks, Dan. I guess the restrictions don't work unless government can trust the population at large. You know, you can't actually stop people from going further than 2 kilometers or 5 kilometers from their home. It's absolutely impossible. If large numbers of people start to breach the restrictions, the government has no capacity to do that. So and I think that was very much understood when the restrictions were put in place, that kind of trust was being placed in people in general. They couldn't be compelled. Ultimately, they had to be trusted to do this themselves for a common goal. But that has to be reciprocal. So that depended on a trust in government, that government was acting in the best interest, that this was being managed in a kind of capable way, and as Gabriel says, a transparent way. And that, I suppose, is one of the most striking things about the situation in Britain at the moment, where you have a perceived breach of trust by a senior government advisor, that trust was broken. And that it's sort of that it wasn't reciprocated, that, you know, it was based on a falsehood, that we trust the population to do this and you can trust us to behave, along the same lines. I wanted to mention very briefly, or come back very briefly to Katie's comment on technology and borders. And the images from China have been so striking, of drones hovering above cars and people, you know, connecting their mobile phones to the drones so that they can be scanned before entering. And whereas 10, 15 years ago, people talked about technology, you know, making borders redundant, crossing borders, the pandemic has, if we didn't realize it beforehand, tells us that borders can now be controlled in ways that were unimaginable. And I think that a general trend is for borders bounding practices facilitated by technology to intensify. And this is sort of just an illustration of that.
Yeah, that's a fascinating point. I want to raise a sort of counterfactual, and it may be one we can deal with briefly, but I was just interested in how this would have played out if the Northern Ireland executive had not been up and running. It was interesting in an interview with Sky News with Arlene Foster and Michelle O'Neill. Arlene Foster was referencing that they, well, thank goodness we were back up and running in January, but they think, well, if they had not been. I don't know if you had any thoughts on that, either from a public health point of view or a political point of view. What would actually have happened if that had not been in place and the standoff had remained where it was?
Oh, I hate answering counterfactuals, but I would say that, of course, bear in mind that the executive came into being and went straight into two big crises, the Brexit, which is pretty much a crisis in many ways, and of course a health service crisis. And there was no dealing with that crisis were it not to have an executive in place and a minister. I think we'd really reached the end of any potential solution. Now, obviously there's a long way to go, and Robin Swan has got an awful lot on his plate. But I think that helped in the circumstances. But of course, when you have the executive in place and the five parties, and particularly DP and Sinn Féin at the heart of it all, you have politics. And of course, we've seen that very much demonstrated, particularly in the early days, and in very dramatic ways, if you like, the difficulty in getting a sort of a consistent, coherent position from the executive that was maintained over, for longer than 24 hours. But actually, I think now, all other things aside, not only is that executive working reasonably well, it's also, we do have some transparency, to pick up Gabriel's point. I think the fact that we do have the Assembly sitting, concentrating on the coronavirus crisis, for once a week for a particular session, I think that's a good thing. And for all its flaws, etc., it is good to see ministers, particularly the First Minister and Deputy First Minister, being held to account by fellow MLAs with regards to the decisions being made in this particular time.
Yeah, I don't know if Gabriel, yeah, you had a.
If I come in, I think it's undoubtedly being handled better by the presence of the executive, but it does. I do wonder about the nature of the governance, because the way in which the ministries were allocated was the choices were done by party size, I think, when it came to handing out ministerial responsibilities. And unsurprisingly, given the poor performance of the health and social services in the north, no one was particularly keen on taking on health. So it was well down the pecking order, and it fell to one of the very small parties, the UUP, and Robin Swan picked up that brief. Now, normally, as I understand it, when you're in a government situation, the First Minister or Prime Minister or Taoiseach or whatever they're called actually has a lot of clout in terms of who the ministers are and can remove ministers, etc. And that appears not to be the situation in Northern Ireland. So we have seen Arlene Foster and Michelle O'Neill put forward a very good strategy for the dealing with, particularly the move away from the lockdown situation in the north, which was well ahead of the policies that were being pursued inside the Department of Health. And I find that fascinating. I do completely agree with Katie that some of the best bits I've seen have been some of the Assembly committees holding ministers to account and bringing new light to bear on issues. And that has been very good. But we're a long way, I think we're a long way off a situation where there's a properly functioning government in all respects in the north of Ireland.
Yeah, thank you very much. I don't, Neil, if you wanted to come in there. Yeah.
No, just briefly. I mean, the mood music between Michelle O'Neill and Arlene Foster has been very good and surprisingly good, given how rocky a start they had when the coronavirus struck. Very intense disagreement on the measures that should be taken. So I'm just like connecting back to something that was said earlier. I was talking to a friend in Derry the other day who mentioned that people in Derry were listening to Stormont, Dublin and London and mixing and matching measures because they're so close to Donegal, they see it in operation there, and there's sort of a combination of responses. But it's interesting. I can't but feel that Sinn Féin or nationalists in the north must be a little bit miffed at the failure of the Irish government to even inform the executive in advance when they're doing things. Even an hour ahead would be nice, instead of doing it publicly. And you get the sense there's this kind of solidarity between the DUP and Sinn Féin. I don't want to exaggerate this, but there was a statement, I think, by Michelle O'Neill. She said, well, it may be Michelle O'Neill or both of them, but significant either way, saying, well, we're not following London, we're not following Dublin, we're acting in the interests of the citizens. Now, there was no mention of the citizens of where, but obviously that's a set of citizens that Sinn Féin and nationalists have not traditionally characterised as a separate, distinct group with its own path to follow. And so the willingness to say, well, we here in this place, we'll follow our own path is striking.
That's a wonderful point. Yeah, just wanted to turn to some of the questions and comments that are coming in. A couple of relating to put them together in a sense about the question of tougher borders and whether there are ways of resisting calls for tougher borders. There was another attendee who's wondering about the implications of Brexit, and I think particularly on the idea of a toughening of the border. I guess that's a rather open question for you all about what your sense is. Maybe it's a question for you, Katie, because you were reflecting on that. Do you think borders are going to be toughened? Is an interesting term that the questioner had. Strengthened might be, that's always seems more positive. We strengthen borders, we never weaken things. But what's your take on that question?
I will answer that, but could I just pick up something that Neil said, or just to finish off that point about devolution? Just that devolution, obviously, as Gabriel notes, I mean, the situation in Northern Ireland is very peculiar. Like, it's a peculiar, unusual arrangement for government here for obvious reasons, or some people viewing it as obvious. But devolution was never intended to deal with a crisis like this or a problem of this nature. Obviously, one that transcends borders in a very particular way. And of course, Northern Ireland is managing it's very much placed between Britain and Ireland with all that entails. So in relation to Brexit and hardening, strengthening, toughening borders, it is going to be interesting because although we have avoided a hard Irish border for movement of goods after the end of transition period, there will be a harder Irish border, for want of a better phrase, in relation to other things, and a lot of that depends on the future UK-EU relationship, but part of it will most likely be in relation to exchange of data and data sharing.
Yeah.
And I do think this is interesting, not least because it does relate to how movement across borders will be managed, and even thinking about Robin Swan's comments with regards to an app, track and trace app in Northern Ireland, saying we're not going to follow the UK one because we need one that can interact with the one that they'll be using in the south. Which is all well and good, and obviously makes a lot of sense. But the question would be, will that data still be able to be shared freely? And will we have cooperation and coordination? Will that be possible after the end of the transition period? So there are huge unknowns in relation to Brexit. even as they still relate to the Irish border, that actually in a funny way are kind of highlighted by this pandemic.
Thank you. There's a question that's come in, an interesting point via Facebook about accountability. That's obviously a huge question. I'm interested myself in what a future inquiry might look like. And I think, Gabriel, you might have referenced that too. There will be an inquiry, and these are well established as in certainly Britain and in Ireland as mechanisms for government to evaluate crises and so on. But this is an interesting one because an inquiry would really need to be more than just within a nation state. Do you have any thoughts about how an inquiry might be managed, and how, to speak to that point about accountability, how we can get to that? Maybe this question for Gabriel in the first instance.
Yeah, I'll have first go at that, perhaps. Yeah, I have unusual views on inquiries. There is always a demand for a public inquiry. It has to be a public inquiry. And my view is that it's best to avoid a public inquiry if one possibly can, because it takes a long time, it costs a lot of money, it is overrun with lawyers, everyone has legal representation, and it plays into the blame game. One of the advantages of not having that quasi-judicial approach is that you can't focus in on individual responsibility. You're forced, because of natural justice rules, that if you have an inquiry without judicial powers, you can't attribute blame to people because they don't have an opportunity to be legally represented, et cetera, et cetera. So it forces you to consider the issues rather than the people. And most of the problems that arise are not caused by malign individuals. They're caused by system failures. And so therefore, I'm not a great fan of the immediate rush to a public inquiry. And as I look back to my youth, it's a long time ago, but Margaret Thatcher was the person who drew to a close a very rich strand of civil inquiry in the UK, and that is royal commissions. There is, I think, one standing royal commission still left on the environment. But when there were big, knotty issues that transcended party politics and were about systemic issues, the way to deal with them was seen to be to set up a royal commission. And it removed it from the political sphere entirely. The commissioners dealt with the issue and came back with a report, which was seen as collective property and was then debated and discussed collectively rather than being an attribution of blame in respect of either individuals or political parties. And I think that was the right way to do it. And I can't quite see in my mind how any one inquiry will be able to deal with the enormity of what has happened. So I think we should be looking at different mechanisms, including ones that involve the public to a far greater extent than we have had involved before in these sort of issues, because I think there are issues of popular concern and popular concern for that justice should be done, particularly to the tens of thousands of people in these islands that have died.
That's extremely interesting take on it. Neil, I wondered if you had a view either on the question of accountability more generally, or perhaps specifically on inquiries and their merits or otherwise.
Not so much on inquiries, but in terms of authority at the moment, and what we see is that everywhere incumbents are gaining in popularity, with the exception of Britain, of course, where they made such a mess of it that they managed to go against the trend, well, and the United States, sorry. But in most places, you see governments that are in charge are seeing their ratings go up. The opposition parties find themselves a little bit more marginalized, find it difficult to get in, because people seek, they're seeking for some central source of authority, in the midst of a crisis. And so that's a great advantage to the current government in Ireland, which is why it can still continue, obviously, despite the fact that it includes ministers who haven't been elected. I'm conscious of questions that came in. Can I just address one of the questions that I see?
Please do. Yeah.
The best way to handle the border issue on the island of Ireland, and the approach of the Irish government. So the Irish government, while it is not coordinated with the North, is not controlling movement from the North. So the new quarantine regulations apply to people coming into the Republic of Ireland from outside the island of Ireland. So there's clearly a loophole there that someone could come from Britain to the North and then cross the border. But I think they're quite sensibly not planning to control the border, so that they are in some senses treating it as an all-Ireland zone. And similarly, people going through Dublin to Belfast will not be subject to Irish government quarantine in the Republic. They can transit through the Republic without any obligations. So there is, to a certain degree, an all-Ireland system in place. And it's clearly has great advantages to have an all-Ireland system. I think the big question is whether the Northern Executive could coordinate with the Irish government in terms of their approach between movement from Great Britain. And that seems the real stumbling block. They can coordinate on all sorts of other things, but the idea that both of them would treat travellers from Britain in the same way and limit in some way their access, that's, as restrictions ease and people can travel more within the UK, that seems to me a sticking point.
Very interesting point. Yeah, it kind of speaks to an interesting comment that's come in from Jerry Killeen, and he was wondering about any thoughts about the Welsh stay at home, hardening their border with England, stay alert, and English politicians suggesting closure of devolved governments to enable free travel to Welsh beaches. I must admit I hadn't seen that, but that sounds an interesting contribution. I mean, there you are in the west of England, Gabriel. So I don't know if you have any particular sensitivities to that scenario, I guess, playing out on the Welsh border. You're muted there, Gabriel. Yeah, Gabriel, you're muted there.
I don't think there'll be anything happening on the Welsh border. I'm not even sure many people know where exactly it runs to a great extent, and but it is amazing. I think I go back to one of the things I said in my opening remarks. It is amazing that in a foot and mouth outbreak, we wouldn't hesitate on an all-island basis, stopping the movement of cattle or animals between Britain and Ireland. We just wouldn't hesitate. But when it is something infinitely more important, like protecting the health of the people from a human pathogen that could be carried by people from Britain or anywhere else to this island, we have an inability to protect human life, whereas we're perfectly happy to take these actions to protect animal life. That seems to me to be completely bonkers. I do agree with Niall about some of the elements are kind of sensible around the mechanisms that the Republic of Ireland is seeking to introduce, even written into the declaration or the notification, the public health notification form, location form that new arrivals are going to have to complete. There is a little small print clause saying that information may be shared with the administration in Northern Ireland. And I thought that was very helpful. I can't quite understand why, if someone is arriving in Dublin and traveling to Dundalk, they have to, getting off the train in Dundalk, they have to agree to isolate themselves for 14 days. But if they get off at the next stop in Newry, they're under no restriction whatsoever. And that's just daft and stupid when we're trying to save people's lives. And they should catch themselves on, really, the politicians north and south, and stop messing around with this, because it's far too serious. The reason why all of these islands elsewhere have been so successful is because they worked at it as one unit. And we should be saying to the politicians that they should put these long-held intergenerational grievances and prejudices and principles aside and just do the right thing for once. And they can pick up all their dislike and hatred and prejudices when it's all over. But in the meantime, could we just keep people alive and do the right thing?
Well, you're quite right. Obviously, there are imperatives here, and one hopes that they override other considerations. Although we can see, certainly in the U.S., that's another topic. We won't go there for reasons of time, apart from anything else. Katie, I wonder, kind of in closing, if I could come back to you and maybe ask you about your thoughts about where we might be. And a questioner has raised this in terms of possible second outbreaks and so on. I'm not asking you to predict the future in terms of the health crisis and so on. But I guess to put it this way, are you optimistic about how the relationships are in terms of managing what is a border and which is a daily reality? Do you think that a further outbreak, a second wave, etc., is going to be, will we be in a good position, I guess, to respond to it, is maybe a way of putting the question, or is there still work to be done?
Well, there's always work to be done when it comes to Northern Ireland and relations across these islands. And I think the key thing is that, I mean, it's notable that there's been pretty good communication, I think, on the whole. Maybe last minute or too late, but generally there has been better communication between Belfast and Dublin and Belfast and London than there has been for a long time, specifically in relation to the coronavirus pandemic. And so the hope would be, I think, that communication could begin to move more towards coordination, to pick up on points that both Neil and Gabriel have made, and the institutions that have been created and the mechanisms that have been created for such coordination, such as the North-South Ministerial Council, could be used much more effectively, no doubt. And the same is true indeed of the intergovernmental bodies within the UK. And I was having a conversation with Nicola McEwan and Dan Wincott about this earlier, about the coordination within the UK, and the intergovernmental bodies that are intended to facilitate coordination within the UK have not been working in relation to this pandemic. It's been very much more sort of bilateral or communications within officials between different departments. So lessons could be learned from this. Whether they will be learned in time for, the second wave, or goodness knows what else will come out, that's a bigger question. This, of course, is not a good time to be having a crisis. We're seeing a huge transformation in, obviously, the economic and legal position of the North, and of course the whole of the UK in relation to Ireland. And so arguably, I mean, perhaps this could be a good point to sort of think about priorities and the value of communication moving towards coordination at a time of extreme flux.
Thank you very much. I'm aware of the time, and with apologies, since there's so many other issues that we could address, but I want to draw things to a close to thank so many attendees for their comments and contributions. We've had a chance to look at them through the chat function, introduce some of them into the equation as we reflect on these immensely complex issues that demand all of our attention and all of our care and effort. Neil, you raised that question of citizenship. I mean, this is a demand on all of us, both to think through our responsibilities in terms of health, but also in terms of the political challenge that faces us. So thank you to all of you. Really been a fascinating discussion, and I really appreciate it. So thank you again.